Today I'm going to talk with you about hip pain. Hip pain can come in a variety of fashions. Acute hip pain, either from an injury, a direct blow, or some type of wrong twist or turn. You can also get chronic hip pain from just poor mechanics, or mechanics where you're walking and you're not activating your pelvic stabilizers properly. Hip pain is very closely tied with back pain as well, so you can usually find these coming together. In looking at treating hip pain, one of the main culprits of the pain is usually from poor gluteal activation. When you're being tested for your hip pain, what we usually do is try to facilitate your glute muscles during a physical examination to see if it improves any motion of hip flexion, abduction, or extension. Your glute muscles are really important for when you're walking. They help your leg swing straight forward, they help your opposite leg hold you up, and they also help swing your leg back. When you're having poor glute activation, your lead leg will start to scissor in a little bit, and your leg that holds you up will start to bow out. That bowing out can cause stretching of your sacroiliac ligaments as well. So these are areas that are of interest in treating. Sometimes you can just focus a good physical therapy program on strengthening these areas and work on the neuromuscular re-education to facilitate them better. Using an SI belt is a good intermittent treatment, but not advisable to use long term, because then you would just be giving your muscles a permanent vacation. When those conservative treatments are not breaking through, we start to try some of these regenerative treatments, and usually some of these areas that we'd inject are your gluteal tendon attachments to your hip, right at that greater trochanter, right around the greater trochanteric bursa. Some people would always think it's just greater trochanteric bursitis, but usually it's from some kind of tendinopathy in your glute tendon attachments. An area that you'd consider injecting with that, if you were going to go that route, is injecting your sacroiliac ligaments. We talked about those can get stretched and frayed over time, but when we can get those more stability, it usually ends up working in conjunction with treating your gluteal tendons.